Countries around the world have started rolling out COVID-19 vaccinations for their respective citizens. For countries with a huge population like Indonesia, the task seemed daunting. Vaccinating more than 260 million people spread across some 17,000 islands is no mean feat. And when will people at the far end of Indonesia, like in Papua, where I am, get their vaccinations? It's the moment Luki Satria has been looking forward to for months. The 46-year-old doctor is finally receiving his dose of the COVID-19 vaccine. The shot will go a long way towards easing some of his worries. Luki has been working long hours on the front lines of Indonesia's COVID-19 fight since March last year. Infection has been a constant fear, and the still surging number of COVID-19 cases has strained Indonesia's healthcare system and exhausted its healthcare workers. Now that a vaccine is here, Luki hopes this means an end to the pandemic is in sight.
Ya, haruslah itu salah satu ikhtiar kita untuk mengatasi COVID ya. Ya, salah satu ikhtiar kita untuk ya selain 3M itu ya salah satunya vaksinasi. Soalnya kalau 3M orang udah bosan kan, bosan, capek, nggak ada habis-habisnya kok COVID ini.
There are high hopes for the COVID-19 vaccine in Indonesia, Southeast Asia's worst-hit country. A national vaccination drive is now underway. But it's shadowed by some skepticism over the country's drug of choice, the CoronaVac vaccine developed by China's Sinovac biotech. President Joko Widodo received the country's first shot of the vaccine, a show of confidence in the drug some of his citizens have expressed wariness over. He was vaccinated a few days after the drug was given emergency use approval by Indonesia's Food and Drug Monitoring Agency. The drug also got the nod from the Indonesian Ulama Council following concern in the Muslim-majority country over the vaccine's halal status. The country's highest Islamic authority issued an edict declaring the vaccine permissible for Muslims to use.
Vaksinasi COVID-19 ini penting kita lakukan untuk memutus rantai penularan virus corona ini dan memberikan perlindungan kesehatan kepada kita dan keselamatan, keamanan bagi kita semuanya, masyarakat Indonesia, dan membantu percepatan proses pemulihan ekonomi.
Indonesia has so far received 3 million ready-to-use doses of the Sinovac vaccine. But there are questions about the Chinese vaccine's effectiveness. State-owned pharmaceutical firm Biopharma's late-stage clinical trials of the Sinovac vaccine showed a 65.3% efficacy rate, much lower than other vaccines like Pfizer-BioNTech's 95%. That disparity has drawn mixed reactions on the ground.
Dengan perkembangan kasus sekarang yang mutasinya juga cukup cepat, saya melihat vaksin yang ada ini masih ada sedikit kekhawatiran sih apakah bisa membantu menyembuhkan pandemi yang ada sekarang ini.
Kondisinya kan mendesak ya sekarang ya. Saya pikir 65% udah oke dan saya sih cukup tertarik lah maksudnya untuk mengikuti vaksinasi ini ya. Memang masih menunggu giliran lah.
Infectious disease experts say the Sinovac vaccine is safe to use and worth taking a shot on.
We don't have the ideal vaccine, but then at least we have now one who can, which we can use as our tools to protect the individual, especially the vulnerable people.
The first stage of Indonesia's vaccination program involves 1.3 million health workers across the country's 34 provinces. More than 250 Indonesian doctors have died of COVID-19 since the pandemic started.
Dari Kementerian Kesehatan, Dinas Kesehatan mengundang semua tenaga kesehatan yang menjadi penerima vaksin di periode ini untuk hadir dalam sosialisasi itu. Dan alhamdulillah mudah-mudahan ini bisa berjalan lancar dan diterima oleh seluruh tenaga kesehatan yang ada.
Authorities will be monitoring the vaccination program closely, and the local government in Jakarta has designated 21 hospitals to treat any adverse reactions to the COVID-19 vaccine. The COVID-19 vaccination program is not only taking place in hospitals but also in community health centers like this. The Jakarta government has received some 120,000 doses of the Sinovac vaccines in the first phase of the national vaccination program. These will be for 60,000 health workers in the capital. Thousands of vaccinators have been trained around Indonesia for the exercise.
Sebelum kita melakukan pemberian vaksin ini, kita terlebih dahulu screening dulu, benar-benar sehat. Karena kalau nggak sehat, takutnya nanti dibilang efeknya dari vaksin.
The task of convincing the public to get their shots will be an uphill one.
Ada persepsi bahwa COVID-19 ini sebagai sebuah pandemi itu bukan murni ya misalnya, ada kelindahan politik di dalamnya gitu. Sehingga ada yang tidak percaya ini jangan-jangan memang nggak ada, tapi ada desain besar untuk melakukan itu. Nah tentu ini tantangan pemerintah daerah ya untuk meyakinkan publik bahwa COVID-19 ini penyakit global yang harus diobati.
Authorities stress that even with a vaccine at hand, Indonesians need to continue abiding by COVID-19 health protocols. That's already a struggle now. Jakarta's public order agency said that public discipline is waning even after tougher restrictions were implemented to curb the spread of COVID-19. Here in Senen Market in central Jakarta, the agency found that mask wearing compliance was low among vendors and customers. People caught not wearing their masks have been punished by cleaning public facilities or fines. Indonesia hopes to vaccinate 181 million people, a figure it believes is needed to reach herd immunity. Instead of targeting the elderly, a strategy most countries are going with, Indonesia is focusing first on those aged 18 to 59, a group considered the most active. The Health Ministry hopes to complete the vaccination drive in 15 months, an ambitious goal. This means the government will need to secure 426 million doses of COVID-19 vaccines. Experts say a long road to recovery still lies ahead for Indonesia, and to ensure the country gets there, the public cannot let up on efforts to curb the spread of COVID-19.
India is another populous Asian nation that has embarked on the arduous task of vaccinating its people against COVID-19. It has set an ambitious target of inoculating 300 million people in just 7 months. India has a total population of 1.3 billion people. It's unprecedented even for India, a country that has a long history and experience of rolling out vaccination programs against a host of diseases such as polio and tuberculosis.
Pranita Chube has been a nurse for 30 years, but this is the biggest task of her career. She's been put in charge of training dozens of medical staff at this public hospital to administer the COVID-19 vaccine. And she's playing a critical role at the Mumbai Hospital's vaccination centre, where jabs can be given to 1,000 people a day. It's part of a target to start by inoculating 10 million healthcare workers nationwide, as India embarks on one of the world's biggest immunisation drives, spearheaded by the government.
मेरे ही जैसे अच्छी तरह से काम करें और ये प्रोग्राम सक्सेस करे, मुझे यही सब उम्मीद है मेरे सब नर्सेस से, और वो सब सक्सेस करेंगे, ये भी मुझे उतनी ही उम्मीद है, और हम सक्सेस हो जाएंगे.
India's COVID-19 vaccination drive would ultimately require the efforts of more than 2.5 million staff at thousands of inoculation centres.
It's not just India who hasn't done anything on this scale. No one in the world has done anything on this scale. So it is clearly a significant initiative, but it's something that I believe everyone is committed to.
India, with a population of some 1.3 billion, is aiming to vaccinate 300 million citizens by August. At 2 doses per person, this means 600 million jabs are needed for this phase. After healthcare staff, frontline workers including the police and armed forces will be next in line for the jabs. This will be at no cost to those being vaccinated, with the expenses being borne by the central government. They will be followed by the over 50s and those with serious health conditions, although there isn't clarity yet on who will be paying for those vaccines. Dr. Vidya Thakur, who runs a public hospital, saw her facility overwhelmed by the pandemic at its peak, and its efforts are now focused on its vaccination centre.
Crowd management and giving the vaccines properly, maintaining the cold chain and keeping the distance, following all the norms regarding the safety of all the beneficiaries, taking the due care of the sanitization. It's all challenging, and it's happening over a very short period.
Like many of her staff, Dr. Thakur was herself infected by the virus and she had to be hospitalised. Hers is among the more than 10 million confirmed coronavirus cases in India, the second worst affected nation after the United States. COVID-19 lockdowns forced poor labourers out of work and saw businesses shuttered, so the vaccine's launch has brought relief to many.
I'm very much happy because it is something positive after so many months of negativity and scary outlook.
Definitely I'm going to take it as soon as it is available in the market.
But one of the questions being raised is, will the vaccine reach those who need it the most?
We need to work very, very hard to make sure that this rollout happens equitably, because it's not just that those sections of society have the most difficulty accessing healthcare, but it's also that we know that COVID-19 hits those areas worst. They have the worst outcomes. So they need the vaccines the most. So we need to make sure that we do everything possible to prevent pilferage and to promote equity in distribution.
So after the registration, the person will be entering here.
Dr. Sanjay Panchal, who's overseeing the COVID-19 vaccination program at this Mumbai hospital, is no stranger to battling epidemics. He has tackled potential disease outbreaks following the devastating earthquake in Gujarat and deadly floods in Mumbai, as well as the swine flu pandemic. He says that just like him, many of India's medical staff are used to the toughest of circumstances.
So I've seen a lot of epidemic and pandemic we have managed previously also. So for us, this is the thing which we have been doing it. We are doing the immunization for the universal immunization program also for the children's.
India is building on its experience of the world's biggest immunisation programme, which inoculates some 50 million children and pregnant women every year against diseases including polio and tetanus. This has helped with the implementation of the COVID-19 vaccination programme. But Dr. Panchal admits that he's never dealt with anything on this scale before.
We have to match the target. 2,400 is the target we have been given per day of vaccination. So only that challenge is that we have to achieve that target, and if we achieve, then only we can finish phase 1, phase 2, phase 3 and so on.
To help streamline the process, the inoculation drive relies on the use of an app called CoWIN, which is used for registration, as well as monitoring of beneficiaries. But the digital platform experienced glitches with the rollout, forcing Mumbai to temporarily suspend the drive. And there are still logistical issues, such as transporting and storing the vaccines, which need to be kept at between 2 and 8 degrees Celsius. This becomes even more of a challenge in remote rural areas. But authorities remain confident.
We have prepared detailed plan for getting the vaccination done. We have prepared blueprint, and we will also do macro planning of the entire process. And all our system is in place.
But there's going to be another hurdle when it comes to mass vaccination. Not everyone wants to take it.
I don't think so that I need this vaccine because in the whole COVID period, I was okay. I don't have any symptoms regarding that.
My concern is about the side effects. What it could be, there could be some side effects with the vaccine.
Some citizens believe the approvals of the vaccines were too hasty. 2 jabs have been approved and are being used in the vaccination drive, the Oxford AstraZeneca vaccine being manufactured locally by the Serum Institute of India, and a homegrown shot made by Bharat Biotech called Covaxin, which was controversially given the green light by the government despite a lack of publicly available data and before completing its late-stage trials. India's health ministry has indicated that people who are part of the government's drive won't get a choice of which jab they're given. The government and doctors believe the public should have more faith in the approved vaccines.
India is, not just the world's largest manufacturer of vaccines, but actually delivers 60% of the global vaccine market in terms of manufacturing. So the skill set and the capabilities available. I believe that the science in terms of the study has been appropriately done, considering that we do have a pandemic.
India's public healthcare infrastructure was already overstretched and weak before the pandemic, and many, even those from lower income backgrounds, opt for private medical care. The government has to tap on the extensive network of private hospitals to help with the mass inoculation. Apollo, a private chain of hospitals, is one of them. It's providing centres across the country and staff to administer the vaccine to essential workers at no cost to the government, and the company wants to play an even bigger role.
We have a plan in place where we have the capability to vaccinate approximately 1 million people a day across our ecosystem. However, this plan is waiting for government approval, access to vaccines, but we felt it is our national duty to be prepared.
From private hospitals to frontline healthcare workers like Ms. Chube, the country may need to rally all its resources as India battles the COVID-19 pandemic with its enormous vaccination drive.
In the West, vaccinations are also in progress, despite getting a head start because of its closeness to the location where the vaccines are being produced. Progress in some European countries are far from ideal. While in New York, different interest groups are scrambling to get ahead of the queue to be vaccinated.
It's been a long wait for a vaccine for the city's transit workers. More than 130 have lost their lives to COVID-19. Protective shields are in place, but bus operator Jim McDonnell says the risk of infection still scares him.
We are in the middle of it, we are. Have you ever seen the bus loads of, we have 50, 70 people on the bus at one time. We need it as much or more than anybody else, except for the healthcare workers.
Healthcare workers were the first group eligible in New York to receive the vaccine. Governor Andrew Cuomo is now expanding the pool of those eligible to include transit workers, educators and first responders. In accordance with new guidelines from the Centers for Disease Control and Prevention, people aged 65 and over also qualify.
We're going to do it fairly. This is a valuable commodity. I understand there'll be fraud. I understand there'll be theft. I'm telling you, we are going to monitor it carefully.
The state of New York currently receives around 300,000 vaccine doses per week. Roughly 40% of the state's available doses have been administered. The governor warns it could take at least 14 weeks to inoculate the population currently permitted to get the shot.
New York City's Mayor Bill de Blasio wants to see 1 million vaccination doses administered by the end of the month. To help hit that goal, the city is setting up 250 vaccination centres like this one here in Brooklyn.
Grocery store workers are also eligible to receive the vaccine. Joseph Georges Ayinga is the general manager at Amish Market's Eastside location in Manhattan. He says the prospect of a vaccine is a relief, but says the rollout could have been smoother.
We pay sales taxes. They know we're here. They could have assigned these codes and say, okay, your store, this is your code, and this is when you're eligible to show up and all that. They could have done that, but hey, who knows? I mean, I'm not sitting in their shoes, but I would have done something a little differently.
Officials say a vaccine is the weapon that will end the war against COVID-19. But Governor Cuomo says it may take as many as 14 million vaccinations to hit herd immunity in the state. He urges patience as this critical ammunition continues to trickle to the front lines.
Each shot delivered at this centre in Paris brings relief. For the frontline healthcare workers receiving their first dose, it marks some light at the end of the tunnel. The operation here began in early January as France expands its vaccination programme from care homes to those most at risk.
520 personnes le week-end dernier, avec une grosse équipe d'infirmiers, médecins, administratifs. Et ça s'est très bien passé et on a vacciné 520 soignants sur le samedi et le dimanche.
Pressure has been mounting on local and national authorities across France to pick up the pace of its vaccination campaign. The country is lagging well behind others in Europe. By the middle of January, just 0.4 shots per million people had been rolled out across the country, compared to 4.5 in the UK. Regional leaders have been calling for more government support.
On aurait aimé qu'ils tendent la main directement aux collectivités territoriales parce que nous sommes beaucoup plus à même d'organiser la logistique, d'être au plus près du terrain. Et d'ailleurs, le centre où vous êtes aujourd'hui est une démonstration. Je regrette que le gouvernement n'ait pas fait une campagne massive de publicité pour justement rassurer les gens.
The slow rollout is in part due to high levels of vaccine scepticism in France. Just 40% of people in the country have said they're willing to receive a shot. But not everyone needs to be convinced.
Se vacciner, c'est se protéger soi-même, mais aussi c'est protéger la société. On ne se vaccine pas pour soi, on se vaccine parce qu'on vit dans une collectivité et qu'on doit protéger l'ensemble de cette collectivité.
Que si on veut s'en sortir, il faut aller se faire vacciner, sinon on n'y arrivera pas. Voilà, et que ça va durer encore longtemps. Faut pas hésiter.
It's not just France which is lagging behind. Even EU nations like Germany, praised for its handling of the crisis, have been accused of administering just a fraction of what's been supplied since late December. The hold-up is in part logistical due to challenges in the cold chain.
There's been political infighting across Europe, but also criticism of the EU's executive arm, the European Commission, for its vaccine procurement strategy. It's been accused of spreading itself too thinly in placing orders, as well as failing to purchase enough.
Last year, the European Commission placed orders with 6, soon to be 7 vaccine companies, of which just 2, BioNTech, Pfizer and Moderna, have been authorised for use. The Commission has defended its strategy and promised increased numbers later in the year.
We bought as much as was offered. Let me say to all of you, it's not just quantities that you negotiate. You negotiate a specific quantity for that moment. So we have all the quantities that can be produced with the plants that are today, and we will have more quantities in the future.
But frustrated at the pace, some EU countries are moving to strike up bilateral deals directly. Hungary has announced a deal with China's Sinopharm to buy its coronavirus shots, the first EU country to accept a Chinese vaccine. More bloc-wide quantities may come, but Europe will need to overcome its teething troubles as it seeks to catch up in the global vaccination race.
Here in Papua, Indonesia's easternmost province, the COVID-19 vaccination program has also begun. The province has received more than 14,600 doses of the vaccine and will administer the health and frontline workers from January to March. That's all we have for you this week. Thanks for watching. Goodbye.